और डॉक्टर स्पीकर जो डॉक्टर विवेका साहब के बारे में मैं क्या कहूँगी, तो हमारे मित्र भी हैं। ये भी वहाँ से हैं जहाँ से प्रधानमंत्री जी खड़े होते हैं, वहाँ से पढ़े हैं BHU में, वाराणसी से। और 7,500 PCTA इन्होंने किए हैं। गिवन में बिग हैंड। अब 10,000 हो गए हैं। और ये गीगा वाली जो आप कह रहे थे ना, वोल्टेज जिनकी चले जा रही है, अभी जल्दी कुछ 15,000 और 10,000 की बारी है। सर इज वेरी मच ट्रेन्ड इन RF ablation, cryo ablation, ICD, CRTDs, pacemakers and so many other devices. मोटी सी बात तो ये है कि ये जो करते हैं दिल से करते हैं, दिल के लिए करते हैं। तो सर प्लीज बिग हैंड टू हिम। एंड जस्ट टू एड वन लाइन, जैसे हमारे प्रीवियस स्पीकर थे ना, he was from allopathy and also Ayurveda. He is a very qualified allopathy doctor, but he is IS also, which I could not be. जब तक हम दिल से खुश नहीं होंगे तो वो खुशी किस काम की है? So he is talking about the real happiness, the heart happiness and the holistic approach. Sir.
Well, so good afternoon to all of you, and I must compliment Dr. Sushruth for conceptualizing this meeting, especially on the birthday of our respected Prime Minister, Mr. Modi. I have got a special connection and special respect for him because he is my, birthplace and my alma mater place representative to the parliament, so from Varanasi. I am a cardiologist, so that's why I think Dr. Sushruth gave me this talk about heart, happiness and holistic health. And in the previous talk also, the whole thing which I am going to talk about has been very nicely elucidated, and that's that if you are happy, you would not have heart disease. If you are practicing holistic medicine, you will not have heart disease. And you would know that when we certify somebody is dead or alive, we look at the cardiovascular activity. If your heart is not beating, the person is dead. If heart is beating, he is alive. And how does heart beat? It beats with happiness, with health. So it's a holistic health. I will tell you a small story that when I was in the university, before the modern medicine in 1971 medical college got started, before that we had holistic medicine graduation. Unfortunately, the fight between the modern and old medicine went a long way, and that degree was not recognized. Professor K.N. Udupa, who was the first graduate, had to take an honorary modern medicine degree from his students whom he had trained. So, if you look at the happiness and heart, it's very closely linked issues. And if you look at the health thing and not merely the absence of disease or infirmity, what does it mean? It means that even if you don't have any disease, you may not be healthy, because you need to be happy from within. You have to be happy from mental well-being, and your societal milieu should also be very good to make you happy. So that is how it's a holistic happiness, holistic health. So if you look at the patient, my professor and director there used to say, look at your patient as a whole, not through a hole. So you should not have a tubular vision. You should look at his, so what we are doing as a cardiologist and superspecialist, we are doing surgical or medical treatment in silos. So we, as a cardiologist, patient comes to me, my heart has this problem, I solve the heart. But does that give the full treatment to our patients? No. And that is why we have got reasons for rehabilitation and all those things. So if we look at the patients, that what is the social support of the patient, what is the financial status of the patient, what is the stress level of the patients, then only that index event can be treated, but the future prevention can also be treated well. So can we evaluate and treat the patient as a whole? And the answer is yes. If we take everything into account together, like medical, psychosocial issues, attitudes and beliefs, and then of course the information and communication preferences. So top 10 stressful life events which brings patients with acute heart attack in our practice is, apart from retirement, marriage reconciliation, job, loss of job, marriage, injury or illness, death of a close relative, and conviction, jail terms, marriage separation, divorce, spouse death. So all these things are stressful mental stress, and the patients can go to acute heart attack and even a cardiac arrest. So the common external causes of stress, major life changes, workplace stress. In fact, there have been studies which have shown, which was published in Journal of American College of Cardiology, that people who lose their job and have got financial loss in their business, they can have severe progression of cardiovascular disease. Financial problems are also, and the children and family. So India is a society where family is very closely knit. So we had one observational study which showed that family members, if they become unwell for some reason, whether financial or health-wise, the stress and the cardiovascular disease becomes more compared to the Western population, simply because the family values there are not so strong. And common internal cause of stress is negative self-talk. So you need to be positive from within. Unrealistic expectations. So Vivekananda had said that the cause of all sorrow and despair is mismatch between the expectation and the reality. If your thoughts are way beyond what the realistic and the reality lies for you, then you will be always negative thinker and you will be in depression. Lack of assertiveness, perfectionism, which we scientifically call as a type A personality. So type A personality is extreme competitiveness, and these are the patients who suffer from high blood pressure, diabetes, and that eventually leads to acute heart attack. So stress and heart disorder is very well known, and if you look at the acronym stress, S is for sorrow, means if you are very sad. T is for trouble, so any kind of trouble in your life. R for reproach, E for ends, S for slowly, and S for suicide. So that is what the full acronym for stress is, and that is why the cardiovascular diseases are so common. So not only the westernization, but increase in stress in our society is also leading to increased cardiovascular disease, and India is now capital of cardiovascular disease apart from the diabetes. Effect of stress on heart has been studied in many various trials, and what it does increase in heart rate, which eventually leads to cardiovascular stress, increase in blood pressure, and we say that retention of tension is hypertension. So if you keep on absorbing the sorrowness, if you keep on absorbing the unpleasant experience, then the blood pressure will go up, and there is no other bigger risk factor for cardiovascular disease than high blood pressure and diabetes. So eventually they have got synergistic action, and they would cause increased precipitation of heart attack and cardiovascular arrhythmias. So we say that a term which is called sudden cardiac arrest means the definition of this thing is that within 1 hour of onset of symptoms, the patient is no more, and that happens because of the arrhythmia. So heart goes into a chaotic rhythm, very fast rhythm, which is called ventricular tachycardia or fibrillation, and can take away the patient's life. If you look at the long-term impacts of stress, there is changes in heart rate, blood pressure, cholesterol level goes up, the triglycerides goes up, and we call it metabolic syndrome. So metabolic syndrome is again a manifestation of stress. So work stress and cardiovascular diseases, as we know, that has been studied, and together heart disease, stroke, and related diseases are responsible for 35% of all the deaths. So recently there was a very nice data published in Times of India that was observational study in Lancet, the respected journal, which showed that the death because of cancer is maximum in developed world. In developing world, it is the cardiovascular diseases which is the #1 killer, and in underdeveloped world, again it is the cardiovascular diseases. So cancer does not figure as high in our society as it is in the Western world. So cardiovascular disease is very much prevalent. As I said, that the angry personality or type 1, type A personality is a big risk factor, and a lot of patients come and they say that I was angry, I had an argument with my friend, family, son or daughter, and then I got chest pain and came to you because of the heart attack. So these have shown that studies have shown anger increases the risk of heart attack by 230%. You can imagine how big a risk factor. So if we can calm down our mind, as the previous speaker was saying, Dr. Sharma, then probably we could conquer this disease to significant level. the executive and the heart, the high cardiac risk type A personality, long-term hours, under stress, self-rationalization. So the more we are stressed out, the more we are under the pressure to perform within the stipulated time, the more the heart problems will happen. And if you have, very fast food, you don't have time for food and all, you don't have time to exercise. A lot of patients come to me that, no, I can't go for walk, I can't exercise. I say that you take at least 1 hour for yourself and then your life will be better. So, it's not that you will become a saint. So by doing this, you are not going to be saint. Social expectations, failure or inability to meet up, training, both the undergraduate and postgraduate trainings are wrong and tedious. Hostile job environment, many doctors share, identify and empathize with their patients, but burden of suffering, inadequate financial and material for the treatment, and it also creates a stressor. So basically, if we have a good lifestyle, we say that this fellow has become a saint. Saintness, as it was shared that, Professor Ramana and all those people, so it's not that you can anyway, by doing this stress activity, you will become a saint. But if you do these, stress-releasing activities, even the regular yoga and exercises, then the things can become better. This is one study which was published recently, and that also showed that, the myocardial infarction is the most common cardiovascular cause and has been assumed an epidemic proportion today. And you look at the conclusion of this study, depression, anxiety and stress were associated with heart attack, which is scientifically called myocardial infarction. So prospective studies has to be, further done in different societies to see how much contribution they are doing. But we see that in corporate life, we have been seeing very regularly that even the patients who are young, less than 40 years, they come with the heart attacks and all. And you can see how much depression, anxiety. So if you look at the common persons and the people who are depressed, almost double the risk of heart attack. The person who are calm has no significant anxiety. The red bar shows the risk of heart attack, whereas you can see the blue bar, the almost more than 2.5-fold increase in cardiovascular events. And the people who are not stressed out, or those who have got acute stress, there is almost double or 2.5 times increase in cardiovascular events. So depression in heart failure has also been shown that depression is something which can increase the mortality. So if the heart is weak, in 5 years, not more than 50% of the patient would be surviving. But if they are depressed, even the survival up to 3 years is very, very difficult. So don't worry and be happy. That should be the motto, but it is easier said than done. If we can inculcate these lifestyles of controlling our emotions, angers, and our behavior, probably things will be better and the cardiovascular disease burden on our society will go down. So the mantra of stress management is, God grant me the serenity and the courage and the wisdom to accept the things I cannot change. So that's a very, very important thing, to change the things which I can and to know the difference. So that is the motto in the life should be. The different, relaxation responses have been shown to yoga. Yoga is very common, now it's being more popular in Western world than in India. So a lot of people have migrated there to teach yoga. The transcendental meditation, we know that meditation is so powerful, and the repetitive prayers and autogenic training, self-hypnosis, these are the various mechanisms by which we can, calm our body and the society. We need to enjoy things which we are doing, like gardening, reading books, enjoying music. Ways to relax is again the good sports, bath, all these exercises, breathing exercises, they are considered to be very good. And stress is a life constant, like taxes and debt, so we need to conquer them. These are again study from our hospital. We had done this and published in Indian Heart Journal. That also showed that the conclusion was that the meditation has a positive effect and sympathetic vagal balance, and that can decrease the adverse cardiovascular event. So we need to change our lifestyle. If we change it, our weight will come down, increase physical activity, reduce salt, quit smoking, and control the alcohol intake to help ourselves. Recommendation for physical activity adults are different guidelines, but bottom line is that more than 30 minutes of brisk walk or exercise should be good enough. And it has been seen that the biggest changing factor which can decrease the cardiovascular disease is smoking, because smoking increases the risk by 38% of cardiovascular event. If somebody stops smoking or tobacco in any form, it can decrease the cardiovascular event by 38%. And there is no medicine which has got such a powerful impact on heart attack. And so the excess of anything is bad. We always try to justify the intake of alcohol by French paradox. But if you take more alcohol, that has been shown that the people who do not take alcohol compared to those who take alcohol, the people who take alcohol, they have got more higher risk of cardiovascular event, whatever the amount they take. So we have to spare some time for your heart, evaluate and assess the status of your body, and that much ignored. And the blood pressure has to be well controlled. So health of our heart is in our hand. Routine screening tests like these things, echocardiogram, ECG, lipid profile, these tests should be done from time to time. And if the person has disease, medication has to be taken because that will further decrease the risk of heart attack. So health is a positive concept, and happiness is the choice, and we need to make a right choice in our life. Thank you very much for your time.